It's a pleasure. Thank you for inviting me.
We've got so many people who generously have donated to the cause to be here. But let's tell them exactly what that cause is. The Sonia V. Willman Alzheimer's Disease Research Fund is a part of the Foundation for Barnes-Jewish Hospital. You work with the Knight Alzheimer's Disease Research Center at WashU. A lot of these funds have been put to use and will continue to be put to use for Alzheimer's research. What are you guys doing with this money?
Just within the past half year, a brand new opportunity to detect Alzheimer's disease in living people has been developed by looking at blood samples. We can now take a regular blood sample and examine it and determine the likelihood that somebody has Alzheimer's disease and help in diagnosis and ultimately in treatment. So these are new initiatives, many of them conducted here at the Knight Alzheimer's Disease Research Center at Washington University. And the Willman funds have supported the discovery of these new biomarkers, including the blood biomarkers. So it's a big deal. The second thing that the Willman funds have done is to support the career development of early stage investigators. Of course, we always are going to be dealing with the presence of Alzheimer's disease in our patients and their families until we develop truly effective therapies. But we need bright, young, committed individuals to come along and contribute to the effort to defeat Alzheimer's disease. And so providing them with startup funds to get their career going at a very critical time in their development has been one of the other ways the Willman funds have been so beneficial.
You know, with the funds that people donated tonight, and, you know, should people be extra generous and dig deeper and donate even more, what would be a one-year goal that you would love to see accomplished with this money?
So improve the accuracy of people with Alzheimer's dementia, to screen people who should be eligible for drugs such as aducanumab, the most recently approved drug that target abnormal brain amyloid. And three, this is a bit in the future, but I think maybe the most promising of all, identify people who have abnormal brain amyloid but have yet to develop the memory and thinking problems.
So when I put on the poster for this that it's a night of comedy and wonder to make Alzheimer's disappear, do you think we can make Alzheimer's disappear? Or was I just throwing out hyperbole, do you think?
I think it is possible that we will have the resources, the drugs, and the will to try to not only treat people who now have Alzheimer's dementia, but try to prevent it from occurring in people who are at risk of getting it.
A lot of the people who are in the audience right now are here because someone they're related to has suffered from Alzheimer's, is suffering from Alzheimer's. They lost them to Alzheimer's. That's why I'm here. Should they have trepidation about their own risks because it's in their genetic makeup, it's in their family? You know, because there's the sense, and I've felt this way in the past, like, oh, if there's a test to tell me if it's in my future, I don't know if I want to know, because what could I do about it? What can we do about it? And are we at higher risk? What would you say?
Now, it's very important to indicate that this type of genetic risk is simply that, risk. It is not a gene that is passed from mother to child or father to child. It is a risk, so that people who have an affected parent are not destined to develop Alzheimer's dementia. The risk is increased of doing so, but it doesn't mean that they will develop Alzheimer's dementia. Even with an affected parent whose dementia begins below the age of 80, the risk is perhaps 25 to 30% after age 70, assuming we lived to age 70, but it is not anywhere near 50% or higher. So we're talking about risk, not causation in terms of genetics.
A big part of my motivation to help raise these funds is so that nobody has to suffer like my mother did, but also, my mother was diagnosed with early onset Alzheimer's in her 60s, so that kind of ticks the box that you just mentioned. I don't want Alzheimer's to be a part of my life again or my sister's life. So, and I'm 40, she's 35. What can we do to try to prevent that possibility right now?
I think maintaining this healthy lifestyle, healthy diet, staying active in all realms is the best we can do at present. The second is we can participate in research. The children of a parent who was affected with Alzheimer's dementia do carry increased risk factors, genetic risk factors, important to understand them and how they may influence one's risk. And third, I think what you're doing here this evening is tremendous, just remarkable, supporting research. This is a disease that is only going to get more and more prevalent as more and more people age, and we must do something about it. The past year has brought two big advances. Let's keep the research support going so that we can get even better drugs, combinations of drugs, and ultimately lead to hopefully prevention of this terrible disorder.
Dr. John Morris, thank you for dropping some knowledge on us tonight and doing all the research that you're doing. We're excited to see what comes out next, and I'm sure. I hope that you are surprised yet again by what science has achieved in the year and years to come. So, thank you for joining us tonight.
Been my pleasure. Thank you.